is and going to bars every night. So here we are.
Here we are. All right, we are going live. And
Okay.
as this thing catches back over, I just need 2 seconds. I'm gonna start letting people in.
Okay.
I feel like this is happening. I don't know what the hell just happened with Zoom. All right, we are on Facebook Live. You have the ability to admit people.
Should I let them in while you're talking so that
If you see them, let them in. If I see them, let them in.
okay.
Let people in. People typically join in online and a variety of places. Hi, everybody who's just coming in. We are setting up all of our recordings. This is the beautiful, magnificent Dr. Lorena White, and we're going to give it a few minutes. If you've done these shows with us before, you know that it takes folks a few seconds to finish falling through. We move slowly around here, especially in COVID time, right? I'm moving on to everyone's place so that I can catch questions. If you guys will just bear with us just a minute or three longer. I'm almost there. I'm running 3 devices right now, so this takes me a while.
Right.
Hi, everybody that's there. All right. I just got one more device that's kind of lagging because I got one real computer, my kid's computer, and my cell phone all going.
Right. No, you got everything working. You got everything working.
I'm trying. I'm trying to figure out where this Facebook Live is right now on my kid's computer. You guys can cut your cameras on. We don't mind seeing your beautiful faces. Don't.
Yeah, I would love to see your faces.
Here. Come on in there.
Hi, Emily. Hi, Rachel.
Hi.
Hi, Aniela, I think.
I think she's still trying to get in. Oh, there's the Facebook Live. Ha! All right. I think I did it. As I tell you guys every week, I'm technologically challenged, but I get a little better. I'm talking to the camera. I don't know why. I don't. I get a little better every time that I do this. So if everyone will bear with me, I'm a little slow because I'm running 3 devices at one time. I'm going to reintroduce myself, and while we're here, and that gives folks a little bit of time to get in. If you're joining us online, feel free to swing by the Eventbrite page. The next 4 or 5 Acu-Points, Black Acupuncturist meet and greets that we're doing are all a benefit for Dr. Mutulu Shakur, for the friends and family of Dr. Mutulu Shakur, so that we can give to his legal defense fund and help to get him home, because they're not letting him go. They're not letting him go for parole. They're not letting him go for compassionate release. And one of the grandfathers of acupuncture in the United States absolutely should not be behind bars as a political prisoner. So I am your host. My name is Dr. Tanisha Dandridge, and I am an acupuncturist of 11 years. Welcome to Acu-Points Black Acupuncturist Meet and Greet. And today we have the absolutely magnificent and wonderful Dr. Lorena White, who is a uterus health specialist. I like to say uterus health because all things relating to a uterus, she dang sure does, and she does well, y'all. So without further ado, I'm gonna let Dr. Lorena White come on in. If you guys have questions, you can type them into Instagram, you can type them into Facebook, you can type them into the chat on Zoom if you have a Zoom ticket, and I will do my best to get to them all. But remember, I'm running 3 devices right now, so I might be a little slow. Please be patient with me. Go ahead, Dr. White.
Well, hello, and thank you all for joining us this evening or this afternoon. I'm not sure where all of you are. I am on the East Coast, so it's 8 o'clock here. I think it's around 5 o'clock where you are. So thank you for just coordinating Dr. Dandridge. This is amazing, and I'm excited to see and talk about all the things that I love. So just a little bit about me. My name is Lorena White. I am an obstetrician gynecologist by trade. I have a subspecialty in reproductive endocrinology and infertility. I'm also a licensed acupuncturist and a clinical herbalist. I am the clinical director of the Eudaimonia Center here in Columbia, Maryland, which is right outside of the Baltimore, for any of you who aren't familiar with the area. We're opening an office in Northern Virginia in Old Town. And we have a truly integrative practice in terms of contemporary and traditional medicine, in that in addition to myself, we have a pelvic floor physical therapist, vaginal steam facilitators, a doula collective, a couple of midwives, a massage therapist, a massage therapist, a nutritionist, a health and wellness coach, and we also have a licensed social worker who runs our fertility support groups. So we truly have integrated women's health because I want there to be a nice synergy between the things that contemporary medicine does and the things that traditional medicine does, and each one does things better. I like to tell people all the time, as an acupuncturist, I can help you with all the movement of your things that are going on in your body, your emotions, and everything else, in addition to the clinical components. But you would not want me to do that as your OB-GYN, because that's just not what my training is guided toward. On the same as an acupuncturist, you would not want me to deliver your baby because I have no training in that, and that's going to be harmful for you, and it's just not going to be something you want me to do. However, when I can marry the two, which I have, and with the practice that we have, we're able to truly address the underlying conditions. And the reason why I integrated our practice was because I felt helpless to a point, and able to address complex women's health conditions, from everything from fertility and endometriosis and polycystic ovarian syndrome, uterine fibroids, chronic fatigue, fibromyalgia, infertility, menstrual irregularities. And I felt I was becoming more of a pill pusher or hormone dispenser and a surgical tech versus actually a provider who was able to facilitate healing. And right now, I feel really, really great in the space that we're in. We have a wonderful team, and we're actually seeing just the fact that you don't need a medication, you don't need a pill. You just need, something that's going to help encourage your body to do what it does naturally. And healing is a natural process. Our bodies can do it. Sometimes we just need a little encouragement in the right direction.
All right. Thank you for that extraordinary introduction. And again, thank you all for joining us both online and everywhere else that all the people are. So forgive me when I seemed a little scatterbrained. So one of the questions that we always ask is, thank you for telling us very much about your practice. Tell us a little bit about where you went to acupuncture school and how long you've been doing it.
Okay, I went to acupuncture school at the Maryland University of Integrative Health. That is in Laurel, Maryland, near Columbia, outside of Baltimore. Acupuncture for me has been probably about 3 years now. My last year of internship plus 2 years of in private practice. Like I said, most of my career I've been a solo practitioner, working in different fertility clinics. And again, I got to the point where it was just not enough. And I wasn't seeing the actual type transformation, the types of healing that I wanted to see as a practitioner. And I knew there was something else, there was something more, there was something different, not only that I expected for myself as a practitioner professional, but for the welfare and the betterment of the patients that I was seeing each day.
Excellent, excellent. So what is one of your best success stories?
Okay, I love this question because it's the same every time. I like treating, my favorite thing to treat is polycystic ovarian syndrome because it's so complex with everything else that people make it, but they make it so difficult. I did my capstone project on it, and it's actually really much easier to treat than everyone makes it out to be. However, my success story is uterine fibroids. And it was my very, 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 very first patient as a student. And she was my first patient when in student clinic. And I knew I did not want to be a general practitioner in terms of acupuncture. My life has been dedicated to women's health, and I knew have been a doula, birth doula. I've done pretty much everything in terms of women's health. So I knew even with acupuncture and herbs, I only wanted to see women and those who were having fertility challenges. So in acupuncture clinic, first patient on my own, she came in and she's like, yep, I have trouble with fibroids. And I was like, yeah, I can do this, whatever. Someone's going to help me. And I got in and they were like, yeah, we don't know how to help you with fibroids. I was like, what do you mean? Like, she's here for fibroids. Like, you're my teacher. You're my everything. I need you to help me.
Wait,
And they're
in
like, yeah,
TCM school, they couldn't help you with fibroids?
no one, even my teachers were like, we don't know what to do with fibroids. Like, you can't, they told me that you couldn't address fibroids with acupuncture. And then I was like, okay, so now what? And they were like, well, tell her to go somewhere else. So I'm like, first of all, this is my first, as a student, this is my first patient. I cannot tell her to go somewhere else. Secondly, I need to get like all the things done. So I was also doing clinical herbalism at the same time. So my teachers with herbalism, they were like, oh, we can help you with herbalism, but talk to me about her case. So her case, she was about 52 years old. She looked like she was about 5 months pregnant. She was not. She had 15 fibroids. The largest one was about 12 to 13 centimeters, and the smallest one was probably around 5 or 6 centimeters. So she has a large abdomen. She looks like she's pregnant. Her periods are out of control, heavy bleeding, a lot of pain, everything. And so she was about 2 weeks out from scheduling a hysterectomy. And she said, I don't want them to take my uterus. And I said, well, you shouldn't have to. Like, that has been my philosophy. I don't think that was how it should be anyway. And she's like, but I don't know anything else. You're the only one who I'm coming to as pretty much a last resort to see if there's anything that we can possibly do. And so on my own, pretty much going rogue, I was like, of course we can help you. Of course I didn't know what to do. I was like, but I felt like there was something that I can do. I'm like, you came here, of course I can do something. So I went back to my herbal practitioner who was my, I guess, my teacher at the time, our clinic director. And she was like, okay, well, this is what you can start. And she gave me some basic formulas. And so that's where I started, with like the basic formula. And I told her, let's set up serial ultrasounds every 3 months so we can see if we're making any progress. And so she said, okay, whatever you tell me to do, I'm going to do. And so we changed her diet. We did some dietary things. We did acupuncture. In the first month, it was twice a week. And then after that was once a week. And then we started herbal therapy. And at the end of 3 months, the largest fibroid, she lost about 20 pounds in 3 months. And that was the first thing. Second thing, at her ultrasound, her largest fibroid, which was 12 at the beginning, was now around 10. And the smallest one was around 3. In addition, her bleeding was way manageable. She's like, I'm not missing work anymore. She's like, after the first month, she's like, I don't have to miss work anymore. She's like, I'm still in pain, but she's like, I don't have to like pop all the pills. But it's way better. So I said, do you want to keep, going? And she's like, of course. She's like, I just want to see what else we can do. So long story short, each month we made some changes with Acu. She still kept coming once a week. We changed her formula several times. And by 6 months, she said, I'm pain free. She was pain free. She had no pain. The bleeding was under control. She's like, I'm actually bleeding, 4 to 5 days now. She still had clots, but she's like, she didn't even care about those. And the fibroids now were all under 10 centimeters. And the smallest ones, I think she only had about 7 or so. 3 months later, same thing. Period was great. No clots, bright red, like all the things that you want your period to be. The flow was manageable, no clots, and she felt great. She's like, I don't know who I am. She had lost about 60 pounds by this time in about a 9-month period. I mean, she didn't recognize herself. And she's like, this is so amazing. She's like, if nothing else happens from here on, she's like, we're great. I'm fine. And she's like, but let me just see what we can do. So we worked together for about a year. She wound up losing about 65 pounds in a year. And this is, I feel, largely the size of the fibroids. And by the end of a year, she only had 3 fibroids and they were all under 3 centimeters. So again, it shows, I mean, and that was her just working with me. This is even before I integrated my practice, this was just acupuncture and herbal therapy. And it was the very, very first patient I had. And now I've learned so much more that I don't even think it would have taken a year if I had been more confident, had better guidance, because I was literally winging that on my own in terms of how and what to do and when to do it and what to substitute. And I knew so much more now. So it just shows that 2 weeks from a possible hysterectomy, that was going to probably leave her with a lot of other sequela or other residual effects and issues, yes, conditions. Now she's a woman who's not only lost weight, all the weight, she's not looking like she's pregnant anymore. She's able to plug into her life and engage in a healthy way. And in general, it was just, I mean, I see her now like once every 3 months just because she wants to come back and like show me that she's maintaining. But that was over 3 years ago. So almost 4 years ago now. So she checks in and she's like living her best life right now.
That is
And no
outstanding.
hysterectomy was needed. And so that's my best. And it's always going to be my best story.
That is
Until
outstanding.
I don't think anybody's going to ever supplant that.
That is an awesome and outstanding story. One of the reasons why I became an acupuncturist was my own issues with women's health and medical racism. Like I had a history of PCOS, and I met a guy named Dr. Lee because I was misdiagnosed with food poisoning. And Dr. Lee gave me some random tar. I still to this day, I don't know what it was. Like everyone always asks me, well, what Chinese formula was? It's like, I have no idea, like Weiji Fu Ling maybe some Tao Hao Ring, sometimes I don't know what it was. And within 90 days of being on this random tar, I went from standing orders to miss school and needing to sit on a towel so that I didn't make messes all over the place, and
Yeah.
things like Percocet and Vicodin, to having an accident at Morgan State because my cycle just started and I didn't have all the things that normally went,
Mhm.
like extreme fatigue and nausea and pain and extreme moodiness and all of these things. You would think that I would really be about women's health as opposed to just trauma.
Right.
But trauma is definitely the thing that I totally gravitate to. And speaking of trauma, do you have anything to say about the effects of things like transgenerational trauma on the effects of one's uterine health, or just trauma?
Absolutely.
Right.
And it's one of those things that I feel like acupuncture does a lot better with than contemporary medicine, because it's not even a factor in a discussion when I do a if I were to do a typical OB-GYN workup or a GYN workup. And I feel a lot of questions are emotional based when we talk about the things that, especially with women, I'm not discounting men, but especially with women, there's a lot of things that we harbor. And our wombs are cavities, they are a hole where
Mhm.
things can easily get trapped and stored. And I think a lot of times we have never, even when we enter into the medical system, our emotional health is almost pushed aside and discounted. And okay, let's get to like what your clinical issue is. But a lot of time that clinical issue has an emotional underlying cause, is something emotional. And especially when we're dealing with fibroids, a lot of times, let's say I ask, okay, when did you start manifesting, or when did this problem start? And they'll say, about years ago. Okay, so let's say 2018. And I always ask, what was going on 10 years before that in your life? So you're like, okay, 2008. Oh, I went through a bad breakup. My dad died. I had a miscarriage and something, something, something. All of that probably has been mal resolved, ill resolved, not resolved, or resolved in a way that wasn't healthy, or just not addressed healthily. And so that, in addition to hormonal issues that are probably come with you when you're born, um, all those kickstart a process that open the floodgates for disease process to not just start, but like you've now created an environment for these processes to continue and to grow. And I find when I ask about that, they're like, how did you know that? And I said, because your symptoms are just that. They're a symptom of something that's been ongoing in your body, in your life for a while. You're just starting to see it. And
Mhm.
so when I ask 5 to 10 years, they give me a story and I'm like, okay, well, how was that for you? What was that like for you? Usually with some type of trauma. There was usually some type of emotional hit that pretty much rocked or shaped their life from that point on. And it usually isn't just one thing, or it is one thing that's really, really huge or really, really traumatic. And it's like, okay, so now where's that residing in your body? How do you handle that? What is the emotion connected to that? Was it grief? Was it anger? Was it sadness? Was it anxiety? Was it worry? How did that manifest for you? And usually there's a cataclysm of a whole bunch of emotions, not just one, but a whole bunch of things that just have not been adequately addressed, or haven't been addressed in a healthy way. And once we start unpacking that, they're like, oh, I never even knew, or I didn't even know that I was still harboring this, or I didn't even know that I haven't even dealt with this. But then there's comes a point and it kind of builds on. And usually within about 6 or 7 treatments, it's like, oh my goodness, that's the lights open up. And it's like, oh my goodness, this is something that is still in me. And yes, there's herbs that are going on, there's Acu that's going on, but the Acu is what kind of helps bring that all up and bring it out so that it can be dealt with in a way that is healthy with a practitioner who is trained to deal with the emotional aspect of those, the appearance and the reappearance of those emotions. And I find that while trauma isn't my jam, it is a part of the unpacking process when you're dealing with clinical processes that have an emotional component as their basis. And uterine fibroids, endometriosis, things that are blood related, things that deal with blood, a lot of time have to deal obviously with circulation.
Mhm.
And from an acupuncture standpoint, that's the, you know, that's the liver, that's the heart, that's the spleen. And so we're dealing with all these things, not just the organ, but the channels that are associated with those organs.
Mhm.
And giving real attention to balancing, and that's what acupuncture really is helping the body to reestablish balance in an optimal way for that patient who's sitting in front of me. um, is it's just such an easier way to help get those emotions up and out, dealt with, addressed in a healthy way, in a healthy environment where the acupuncture is holding space for you, um, so that you can deal with the actual clinical component.
I agree wholeheartedly. I tell everybody, whether you want to be treated for stress or not, I'm going to treat the stress because that's probably half of your problem. Uh,
Yeah.
Now, I don't know why my doorbell is ringing. Nobody should be coming here at 5 Sundays. We're going to ignore it. Okay. So one of the big topics that is happening in women's health right now is the health disparities that is found, particularly in women of color surrounding birth. Do you have any? I have plenty of thoughts, but as you are the expert today, any thoughts surrounding women of color and our birth disparities that we are experiencing in this country?
Well, the two things I like to always, when this question comes up or this topic comes up, is I talk about Serena Williams and Beyonce. There are two
Mm-hmm.
women in our that are well known. They're Black women. They're powerful. Money is never going to be an object for them. They have literally rented out whole hospitals, whole suites. So money that is not a barrier for them to get quality care. They have the best of the best sitting literally in the palm of their hands in terms of the best physicians, the best diagnosticians, all of that. And if those two women have experienced potentially um, detrimental to both mother and child interventions during their pregnancies, where does that leave the rest of us? And the
Mm-hmm.
rest of us do not have access to the same things that the Beyoncés and the Serenas of the world do. So one thing I want to always examine is, okay, what is your lead up in terms of not just the labor and delivery, but what was your care like up to that point? And a lot of times we think of, okay, baby's being born on it, at the 9 month point. But there's been ways that your pregnancy has either been managed or mismanaged, again, sometimes in traumatic ways, that lead to a labor and delivery that's pretty much, I don't want to say destined for, but destined for some complications that are unnecessary just by the nature of the lead up to labor and delivery time point and phase in your pregnancy. So when I think about that, first of all, Black women, when you step into a delivery room, we're already looked at as being able to handle more pain, being able to deal with more pain, and on the flip side, problems.
Mm-hmm.
And those two, and when they come together, that leads for already it sets the scene for more interventions or ignoring the need for interventions. And either side of that is problematic. Um, a lot of times we don't necessarily have an advocate. There's not a doula in the room with us. There's not another us partner who's advocating for us. There's not another person in that room who can be our voice in a way that when we cannot speak for ourselves.
Mm-hmm.
So as a consequence, all of our conditions are over medicalized so that they don't have to be managed adequately and appropriately. I've seen this with my friends. I've seen this with my colleagues. I've seen this even before I even come into a room with my patients that have been treated in ways that I'm like, well, how did we get to this point in this stage right here? How did we get here? And there's a lot of gray areas where normally there's a protocol for this, and protocol just wasn't adequately followed because of how someone interpreted a sign or a symptom differently for women of color versus our Caucasian counterparts. Um, and I find that that's challenging because as a Black woman, I'm looking at situations completely different from the time the woman comes in and needing care, and who's on her team, and is there going to be a need for me to intervene earlier. So there's a lot of challenges when we enter a hospital who when there's not necessarily a well-informed team who is a part of the process. And as I was talking with Dr. Dandrews before we even started recording, is OB-GYN care is for, or OB care is for complicated pregnancies, pregnancies that are high risk. If you are not a high risk pregnancy, I always go for a midwife or a family practitioner who does OB, because then you're going to get more of the comprehensive whole woman care that most women want, who will be able to steer you towards interventionless, non medicated forms of remedying a specific concern or issue versus intervention, surgery, something that is less invasive. And oftentimes, when it's women of color, Black women, it's like, okay, we got to go straight to C-section, when there's at least 3 or 4 options that we can do before we go to surgical intervention. And I think a lot of times we don't have enough information or education about our own bodies before we get to labor and delivery. And a lot of times we never have. So when we get to labor and delivery, we don't know what to expect. We don't know how our bodies are going to respond. We've never been taught what is acceptable or normal or healthy or natural. So by the time we get to labor and delivery, there's a lot of confusion. There's a lot of misunderstandings. Just a lot of anxiety, a lot of pressure. And so there's a baby here. There's my life here in terms of a woman who's ready, preparing for delivery, and you don't want to make any mistakes that are going to hurt either one of you. So it's like, okay, whatever the doctor says, I'm just going to go with because I don't want to make any mistakes. And usually there's a lot of time between, okay, there's we're trending in a direction that's less than optimal, and there's several steps that can be done before the, hey, we got to take your baby to save your life or to save the baby's life. And I think we're often put in a pressure situation. Going back to the Serena situation, I mean, she knew her body. She's a high profile athlete. She literally knows her body well, and she's had problems in terms of her own condition for several years before. She knew something was going on. She knew something wasn't right. She tried to get the attention of her staff in terms of helping her identify what is going on. I think something's wrong here, and she was ignored. And then when it got to the point that it was like, okay, now it's do or something is seriously going on, yeah, she was now almost at the point of losing her life because they waited too long to attend to a matter that she had already called to their attention hours ago. And again, when that's someone who has means, that someone who has access to all the best, that same thing is happening all around. So again, we have our maternal mortality rates are astronomically abysmal in comparison to what they should be, and there's no reason for it. And I think and I know Black women and women of color are the ones who are suffering and paying the consequences.
Absolutely. That medical bias is, it's a huge thing. That's one of the things that I'm teaching about in the variety of classes geared towards acupuncturists and our entire side of the medicine. Like we're not taught very often. Actually, I don't think many people really have to go through having to address their medical bias or having to understand their intrinsic biases that they have before entering out into the medical field. A number of studies where medical practitioners, believe things like you said, that we have thicker skin, that we have a higher pain tolerance, that we have nothing but drug-seeking behavior kind of things. And it doesn't matter the foods that you eat or the amount of money that you have, you're still subjected to these kinds of misconceptions and these kind of preconceived notions. And speaking of foods and diets, this is like one of my favorite ones. I love the people who think that a raw food, vegan juice, salad, meatless, all the things, all the isms, right? All the isms, especially being over there on the East Coast, you know what I'm talking about. These individuals who believe that if I just eat enough raw food, if I just drink enough smoothies, if I just have enough salads, that this is going to solve my crappy cycle problems or my menopausal issues or my uterus dysfunction. Can you go ahead and speak on that? Because when I talk about it, especially here in Sacramento, like people look at me like I got horns growing out of my head. What do you mean stop drinking my smoothies? I mean stop drinking the daggum smoothies. It's not helping you at all. So tell me a little bit more of your opinions on diets.
Okay. Like, just when diet is probably one of the hardest conversations to bring up, especially with women who are experiencing fertility challenges.
Mm-hmm.
And the first thing outside of acupuncture, outside of herbal therapy, is I inquire, what is your daily diet like? Do you have any dietary restrictions? Raw vegans, vegetarians, and those who are like, oh, I eat, really healthy. I have a salad, 3 times a day, that kind of thing. Those are the worst scenario in my head is coming to fruition, because not only one, are you working against yourself,
Mm-hmm.
these patients are usually the ones who, like, when I tell you dig in like a red-nosed pit bull, in terms of like not letting go of the one thing that's literally probably the biggest thing that's preventing you from
Getting better.
um first of all, when we deal with the overall scheme of things, your uterus has a lining. If there's no lining for that embryo to implant, you can have all the sex that you want in the world, perfect sperm, perfect eggs. But if there's no uterus in lining to implant in, you will not get pregnant. Let's just say you manage to get pregnant, you will also not stay pregnant because that lining will not be able to support that growing embryo. Um, a lot of time, raw foods, when we deal with herbs, when we deal with acupuncture, we're dealing with temperatures of food, not just the type of food. So when we're dealing with a lot of ice creams and raw foods that aren't cooked, and I'm not saying cook the life out of anything, but just put a little heat on it.
Just a little.
A little
Tiny
heat on it. Yeah, just a little heat on
Just
it.
pass it by the fire for a few seconds.
Yeah, just like graze it over, like let it wilt just a little bit. That can take, I mean, it changes things, that changes the whole dynamic. So we're not only talking about the temperature of food, and raw foods are always going to be cold no matter what they are. They're just cold foods. So I'm not just talking about ice cream or frozen foods, but just the overall temperature of foods. Anything, a light saute just takes that edge off food, makes it easier to digest. So your stomach isn't having to like heat up something so that you can digest it and work harder. So when we're looking at vegans, vegetarians, those who have some really strict dietary restrictions, um, the first thing we have to deal with is diet. And I always tell patients, I can give you all the herbs. We can do acupuncture every day, all day. And all we're doing is constantly resetting every single time, because the food and what you're putting in your body is always going to override the acupuncture, because it is part of you, and part of treatment is engaging in your treatment. Our jobs as acupuncturists, herbalists, is to facilitate movement toward what's optimal for you. However, if you're in our treatment rooms for an hour a week, let's just say 2 hours a week, but for the other 24 hours a day, or 24 hours in that day, 23 hours in that day, you're using going back to the lifestyle, the food. You're just undoing all the work that we're doing together, and we're never going to be making the progress that we could. Food is the easiest way to make those changes. And so when we're dealing with blood, our team, even myself and our nutritionist, we use the blood type diet. A lot of people aren't familiar with it, or if they have heard of it, they think it's kind of like woo-woo craziness. But pretty much blood types take into account that there are foods that are good for you, but aren't good for you. And those who have an A blood type, for instance, they thrive on a vegetarian-like diet. Not all veggies, but vegetarian-like diet. Those who are O blood type thrive on a diet that is lean meats, vegetables, a variety of foods. So if you're having someone who has an O blood type and they're raw vegan, the chances of you like having a successful pregnancy are slim to none. Um, and that is one of the things that I do really emphasize when I'm working with patients, that I don't want to give anybody false hope. And if you're having challenges, now is the time to engage in terms of making some lifestyle changes, not just changes so you can get pregnant, because they're going to repeat themselves. And sometimes you may be fortunate that they don't repeat themselves the next time you're trying to get pregnant. But more often than not, you're going to revert back to that behavior, to that lifestyle during pregnancy. And those complications are just going to recur and happen again. So the thing is, in terms of diet, is making sure that there's a diet that is going to nourish you from head to toe, not just so you can get pregnant or stay pregnant, but that are really going to have a lifestyle change that's adequate and designed for you.
Awesome. All right. So there's a couple of questions coming in. If you have questions that you would like to present to Dr. White, feel free to type it into any of the various chats wherever you are, Zoom, Facebook, Instagram. And so Bear and Beards says, have you ever dealt with patients who had a uterine artery embolization for fibroids?
Yes, absolutely. So I want to talk, now that you brought that up in terms of a specific treatment, I want to kind of dispel a myth that uterine artery embolizations or myomectomies are better than hysterectomies. While I don't advocate for any of it, especially if it's something that we can work on with a combination of different therapies, a hysterectomy is definitely going to alleviate your heavy bleeding problem. Definitely going to alleviate your fibroid problem, but it's also going to come with a whole set of other challenges. When you take your uterus out, yes, you don't have to worry about the heavy bleeding, the pain, the cramps, the monthly periods, any of that. But now that there is now a hole, an area, a space where your uterus used to be. And the surgery and everything else that went along with that could lead to possible adhesions, could lead to just prolapse of different organs, because again, there's a space there. I won't go any further than that because I want to go back to the other possibilities. Myomectomies are when they go in and they actually just take out one or two of the fibroids themselves. A myomectomy, a myoma is another word for fibroid. So a myomectomy is when they actually go in and just take out the fibroids that are causing the potential problem. Now, a uterine artery embolization is just that. Instead of taking out any fibroids, you're literally cutting off the blood supply to the fibroid. The tricky thing about fibroids is that they need a blood supply, that much is true, but they also grow based on hormonal fluctuations. They're based on estrogen and progesterone. So even if I cut off the blood supply, that will be stunting some of the growth, but your hormones are going to steady be fluctuating. And some women already have a higher level of estrogen. Sometimes the estrogen and progesterone aren't the right ratio. So those fibroids are going to continue to grow even with a uterine artery embolization. And a lot of women are not educated appropriately in terms of fibroid recurrence. They'll go in and they get all their fibroids taken out, but fibroids also have a process associated with them called seeding. And seeding means like they're little microscopic, even the doctors can't see it, that are already in the tissue. So even if let's say you had 12 fibroids, they go in and take them all out. Let's say you had 40 fibroids, they go in and take them all out. There's still going to be microscopic fibroid seedlings that are still in your uterine tissue, uterine muscle layers that are there. And guess what? As soon as your hormone fluctuation and life spring, they continue to grow. They're going to start growing. So in about a year, 2 years, 3 years, guess what? You're going to have fibroids again. So unless you take out your uterus, you're not going to be rid of the fibroid problem. And myomectomies and uterine artery embolizations come with their own series of side effects. And you're also not addressing the fibroids anyway.
At all.
So, like, at all. So, the key is to addressing the hormone imbalances. And you don't also need to go on birth control to do that, because guess what? Hormones are made of synthetic, they're supposed to mimic natural hormones, but they're actually hormone disruptors. So, one, they change the way your natural body and their the hormone fluctuations are moving. And secondly, they're synthetic, they're man-made. Your body can't really recognize them, so they don't know what to do with them. Hence the cascade of side effects that you're going to have. So now your body is the hormones that your body is normally making have been disrupted, and your body doesn't even understand what this synthetic thing is, this man-made thing is that you're taking. So your body's doing all the crazy stuff. So on top of that, there's just a lot going on that you never wanted to happen, and your fibroids are still present. The key, again, with herbal therapy, you can create a hormone balance without having to remove those fibroids and just disintegrate them and decrease their size.
Awesome. Awesome. All right. Still opening it up for questions. A lot of them haven't come through yet. I think people are just like basking in your wonderful brain. I know I am. I just, I like to rub up against a wonderful brain. If anybody has a question that they would like to ask about women's health, again, either jump on if you're on Zoom. I don't think you can jump on Facebook. Type it into the chat. Just go ahead and let it all out.
Yeah, I wanna answer the questions that you have. Again, I can talk all day, but I don't want to drone on about stuff that's not of interest to anyone. So feel free to ask anything. If I don't know the answer, I will definitely tell you I don't know, but I will promise to get you the answer if I can find.
While we're waiting, I know that one of the other things that we haven't quite touched on yet is women who are experiencing the change. We haven't gotten to that one yet, right? I'm getting older. I've started treating myself with some yin deficiency herbs because I'm getting older, and I started to notice that if I don't, I have personal summers, and it just takes a little bit of herbal memory every now and then to
Yes.
from being the hottest person in the room.
Yes.
But acupuncture and herbal medicine in particular, is wonderful for hot flashes and night sweats and menopausal changes. Can you talk a little bit about that?
Absolutely. Well, first of all, and this is a completely different perspective that has nothing to do with contemporary medicine, but when we look at traditional medicine, Chinese medicine, yes, I love Les or Leah. I'm going to answer that question, and it's a part of this answer.
Oh, yeah.
So when we look at cycles of 7, men have cycles of 8, women have cycles of 7. So when we get to cycle of 7, when we get toward that end, around that 42, 49 range, that's where the climacteric syndrome or menopausal syndrome comes into play. So when we look at that, again, I'd say for the most part, 90% of all women's health issues are hormone related. And that from puberty, from all the way through our fertile reproductive age, all the way to menopause, when you cease to have a menstrual cycle because there's no more ovaries that your body has, then they're all hormonally related. Even when you have mid-cycle bleeding or anything else, it's all hormonally related. So when you have fluctuations in terms of heat or night sweats or brain fog, all of that is because the balance of estrogen and progesterone is no longer synergistic and working with each other. There may be one higher than the other, one lower than the other, at times that they shouldn't be. And again, all these things can be worked out with acupuncture and herbal medicine. And Leah, to answer your question, we have a vaginal steam facilitator on our team. I used to be a vaginal steam facilitator. When I opened the practice, I just didn't have time to steam anymore. I think during COVID, I've been steaming more than I have just because more women are wanting it and desiring it. And we use steam a lot for our menopausal patients because it's a way to address hormones, to address vaginal dryness, all the things that kind of go along with menopausal symptoms, menopausal hormonal fluctuations. And steaming is one of the modalities that we definitely use for that. But in terms of menopause, again, it's a hormonal fluctuation, and it does not need to be medicalized. It's a condition. It's not a disease, and it is a natural, just like a monthly menstrual period is a part of a woman's life. There are ways to experience it in a healthy way, and there are ways to experience when you start having a lot of symptoms that is maybe normal for you, but it's not natural. And I think a lot of times we talk about, oh, that's normal, but cramps aren't normal when you have a period. Heavy bleeding isn't normal. It may be normal for you and how your menstrual period um, displays itself or manifests itself, but these are not normal occurrences. These are symptoms and signs of dysfunction and disharmony. Same thing with menopause. On the other end of the spectrum, heat flashes and brain fog, vaginal dryness, all these symptoms, they're just telling you that there's a disharmony and some type of dysfunction going on in one of the parts of your body. And our job is to kind of bring that back to normally help your body remember what normal, what optimal and natural is. And so, Leah, to readdress your question about vaginal steaming and fumigation with Chinese herbs, I only use Chinese herbs. Our vaginal steam facilitator, she uses Western herbs. Um, I am biased because that's what I learned. I find that we have a lot more. The herbs, yeah, I mean, there's so much more. There's so
so
many
much
more.
more elegant. It's so, I love Chinese herbal medicine. It's so beautiful and so elegant and so balanced, and it's not so picky choosy. It's, when you're talking about the emperor herb and the envoy herb and the way that we discuss herbs versus the way that naturopathic style herbs kind of go about, I really love.
Yes. It's an art. Feel it's more of an art instead of a science. And so when I'm putting a herbal formula together, like you said, it's about not just, okay, I want this to do this and I want, because there's like 1,000 herbs you could pick to do one thing.
All the same thing, right?
Yeah, but how is that herb going to relate to the other herbs? How are this herb going to relate to this person's body? What other conditions does she have going on? It's not just about the menstrual bleeding. It's not just about the heat flashes, but she also having trouble sleeping, or she's having insomnia, or she's having some digestive issues. And there's not an herb that's going to, I don't need a formula for each one of those things, but there needs to be a nice amalgamation of beautiful herbs that can address all of those things. And I think that's where the art of vaginal steaming and Chinese herbs comes in. And yes, I have to say probably about 80% of our patients are steaming for some reason, until they can start either steaming on their own or coming in after menstrual, because we're a no douche facility, like douching in.
We're gonna get to that one in a minute, but there's like 3 questions waiting.
Oh my bad. So yes, to answer your question, we recommend vaginal steaming all the time, Chinese herbs, and it's a win.
Definitely a win. All right, hold on. So one of the questions we have from Hammond Scott on Facebook, because I know you thought I forgot and I didn't, is what was the formula that you used for the first case? In the beginning, the lady with multiple fibroids, and I think it was more than one formula, which is pretty common in Chinese medicine. It is normal to have to fluctuate from one formula to the other based upon how your body was responding to things, especially as women. You're not the same woman from week to week because your hormones are supposed to fluctuate from week to week so that you have a healthy cycle. So Hammond Scott wanted to know, what formula or formulas did you use for the first patient to decrease fibroids?
Okay, I'm gonna.
This is not a way for you to go treat people,
right? This is something that I'm going to tell you, and it's not me being. I forget the person's name, but I'm not singling you out or trying to be contrary. But a lot of times, I do not. I picked that formula because that was what the book said. That was the first thing, because I knew nothing about herbs. I knew nothing about dosing. I knew nothing about anything. And when I'm teaching, when I'm giving people information about formulas, that was probably the worst way to treat a patient, because that's what the book said. When you are coming up with an herbal formula, I treat the person that's sitting in front of me, because I could have 10 women coming in a week with fibroids, but none of their presentations are going to be the same. So I cannot treat them with the same formula. Again, it was my first patient, nobody really could give me any help. So I just looked it up in the book. what it said to, and that's what I started with. And I think it was one of the Jouet Futongs, and I can't remember exactly which one, but it was one of the Jouet Futongs. Um, and again, that changed in like the first week, because then I started learning more about the herbs, what each of the herbs do, their temperatures, what channels they went to, what her manifestations were. And I was literally learning on the job, so to speak, because I had no clue how to even put a formula together. But I was learning because I really wanted to help this woman. And so now I don't even think I ever use that formula anymore. And if I do, it's heavily modified with some of the same herbs, but
Mhm.
it's heavily modified. I was even talking to Dr. Dandridge. I am what most people would call a heavy doser in terms of getting to therapeutic dosing. Um, a lot of people are afraid to use Chinese herbs in terms of the dose because they're not FDA approved. But we're licensed, we're trained, we know how to do the things that we're doing in terms of what other medications you're taking. And a lot of times, herbal therapy doesn't work because they're not even reaching a therapeutic dose of the herbal formula that you're taking. Um, so it's not necessarily a heavy dose, it's a therapeutic dose. And I cannot, I know it's one of the Shui Futongs because I think that's what is written in the textbook for everybody. Um, However, that formula I probably hardly ever use today, because everybody's who comes in with a fibroid or fibroids or diagnosed with fibroids, their whole history, their whole symptomatology, their all the manifestations are different. So I treat them accordingly, and that results in different formulas, different doses, and different time frames.
Okay. Some other questions, and again, I'm getting to all the questions, so if you guys just hold on and bear with me. Do you journal your case studies? If so, will you or have you had them published?
Great question. When I first started, I didn't even think about that. However, over the course of the last year, every case one, everyone has a patient history book, in terms of their patient files. So I definitely, not necessarily journal, but the ones that are tricky cases, the ones that are complex. Now that we have a team working, everyone is usually on a 3 month, 6 month, 9 month, or 12-month program. And I definitely have started using cases that are complex or tricky in nature or just interesting, um, so that one day I can publish some sort of, I don't even know, compendium or something in terms of case studies to show the efficacy and the efficiency of acupuncture and complementary medicine to treat complex health conditions without the use of surgery, without the use of hormones, and without the use of um, painkillers. Because it right now, the way we practice is pretty much uncommon. Not many practices practice the way we do or have the access to the physicians and the practitioners that we do. And a lot of time with yoga, with massage, with vaginal steaming, we can address a lot of things a lot quicker and with longevity and in a sustainable manner than you can with a painkiller or even a surgery. So that is in the works. I do have a collection of case studies, and one day I hope, yes, that they will be published.
Okay. So I lost one of the computers. So sorry, Facebook. I am going to have a hard time seeing some of those questions. But one of the last questions that came in that I saw on Facebook is talking about spotting in the first trimester.
Spotting in the first trimester. Excellent question. Again, a lot of times as patients, we have been trained to think that there's a one size fits all answer in response to every question. And again, I'm not being contrary, but I want you to know that it could be a myriad of things. Again, it all goes back to hormones and hormone regulation. And it could be, again, an imbalance between estrogen and progesterone. It could be uterine lining deficiency. The lining of the uterus isn't thick enough. The breakthrough bleeding could be because your luteal phase and your follicular phase are off. There's a lot of different things. However, it can all be controlled with acupuncture and herbal medicine. um, and it's not always a life threatening condition for you or your baby. But it's anytime you have bleeding in the first trimester, anytime you have pretty much have bleeding anytime throughout your pregnancy, it does warrant a checkup, and it does warrant a professional intervention, just so they can see what the possible reasons and rationale could be for your bleeding. But it's different for every single woman, and it's something that needs to be taken in consideration in terms of the color of blood, the quantity of blood, pain associated with it. There are a lot of other manifestations that need to be taken into consideration before I could give an adequate diagnosis, and your
Okay.
previous history.
Right. It is complex. That is one of the beautiful things about traditional Chinese medicine, is that it's not cookie cutter. It really is specific, because bleeding can be due to a deficiency. Bleeding can be due to excess heat. Bleeding could be due to a lack of blood, or a lack of spleen qi deficiency, or like an obstruction or a qi and blood stagnation. Like, bleeding could be due to a lot of things. And without being able to see that one particular person, like answering some of these specific questions without more background is a little bit hard. But that doesn't mean that these things can't be addressed with traditional Chinese medicine. One of the things we have, I have questions coming from everywhere. So
Okay.
is there any difference in treating fertility and potential pregnancy in people 35 and older from a TCM perspective? And that goes back to our cycles of 7.
Absolutely. Well, when I'm wearing my REI hat, when I say REI, it's reproductive endocrinology and fertility. I I would be professionally, I'd have to tell you at 35, you may have to get donor eggs. I may have to say, okay, you're really going to be at a high risk. It's a high risk pregnancy. Um, all of those things are going to be part of the explanation and things that I tell you, just by your age, regardless of what's going on with you, what your condition is. Those are the things that would be coming out of my mouth when I was wearing that hat. However, at 35, your body is doing what your body does in terms of cycle of 7. You are at a point where your vital energy is starting to wane. This is a natural process. As women, we are born with the eggs we're going to have for the rest of our lives. Men, they create new sperm all the time until they die. That's one of the incompatibilities that happen. I mean, it's just that is a fact of life. We're not going to have eggs for the rest of our lives, even after. So that's what menopause is. So when at 35, yes, your egg production is going to start to wane, and the quality of those eggs are going to rewind. Your egg production has already stopped when you're born. The quality of those eggs are going to start to wane because now they've been in your body for 35 years. Um, so that's when you start having higher risk of birth defects and trisomies, the different types of birth defects and things that we want to control for, chromosomal abnormalities. However, that doesn't necessarily have to happen. I have patients who are bumping up to, I think my oldest patient was 48. She had her baby when she was 49, naturally, no REI, no artificial reproductive technology, no in vitro. And she had a period. And I tell everyone, if you're still having a period, it's still regular. That means there's still eggs. You can still have a baby. Now, you can have someone who has a Down syndrome child or has a chromosomal abnormality at 28, the same way. So it's not a guarantee. However, the chances are a little bit different. The chances are going to be a little bit higher just based on natural anatomy and physiology of the eggs that we're dealing with. So yes, I would treat again. I look at the fertility patient and person who's having fertility challenges. What are their symptoms? In addition to not being able to get pregnant, what else is going on in their bodies? And I'm going to treat that condition, not just the fact that you're not able to get pregnant, but what else is going on in your body that's impeding that process.
All right.
Not just based on age.
It's not just based on egg age. And, and the thing that I like to tell people is, like, just because you're getting older doesn't mean that you can't do this. I think one of my oldest pregnancies was about 44, 45, and it was a whoops baby. I tell women, like, 40 is a good time to get pregnant. Like, your body is doing everything to that last one. Oh no, I have no idea why, but Instagram Live is going to end and I'm going to cut it right back on. So like, don't freak out all the people who are watching. Apparently we have like literally 1 hour to do this. So what about early water breaks in the first and second trimester for gestational bodies? So hold on, before you answer that question, I'm going to end this Instagram Live. Hold on, and we're going to restart it. So you guys jump back on. Hold on. End video. Share to Instagram Live. Wait. Acu-Points. You guys, I'm really not good with this. We're going to post that one, and then we're going to come back over to it, and we're going to click that live right back on. Because this was an Instagram question. So of course the Instagram is going to die right when you answer the question. So I want to say, like, give it like a hot second for people to figure out to jump back.
Yeah, I'm gonna wait because I want those who are, again, technology is not my jam, so I appreciate you for doing all the heavy lifting in this regard.
Thank you. I appreciate you. I appreciate you for coming and understanding that this is a little bit hard for me, and I'm learning and figuring it out and getting used to it. It took me a minute to figure out how to do videos on Instagram. It took me weeks to figure this out, and several YouTube videos, and the fact that I had to download another app to be able to do this. There you are. She's back. Okay, she's in here, and her question is, what about early water breaks for first and second trimesters? Pregnancies, I think, was the question. And she's back. Yeah, what about early water breaks in the first and second trimester for gestational bodies? That was the question.
Great question. I love the way you worded it. The main thing is that if your water is supposed to break when cervical dilation happens and effacement happens. So when you're looking at a cervix, I can't really do it with my hand, but if a cervix is this, dilation is when your cervix actually opens up, and full dilation is 10 centimeters. And that's about the size of the top of a baby's head. It's not a really good circle, but effacement is when it gets thinner. So instead of it being this, it's this. Does that make, I hope that makes sense. If it makes sense, hopefully let me know. But if this is your cervix and it's normally dilating is when it gets bigger, and effacement is when it gets thinner. So if any of those processes happen during the first and second trimester, that means you're having what we would like to call a imminent miscarriage. Now, there are ways to slow that process down. And for the most part, when your water breaks between first and second trimester, you're going to be put on bed rest. You may even have to get a cervical cerclage. But before you get those things, there's my favorite remedy, herbal remedy, is Bujang Ichi Tongue, where literally it is designed to pull everything up. And I've had patients who are on bed rest. I've had patients who are like, yep, this happens every time I get pregnant. We put them on some Bujang Ichi Tongue. And then at the end of their pregnancy, I'm trying to like help the baby get out. Cause like you said, baby's like, yep, you put me up in here, you trapped me in here, and now I'm not coming out. Like, I'm good in here, I'm staying in here. So to avoid having a C-section, now it's like, okay, now we got to get these needles going. So now we can get baby to the point that we can not have a lot of intervention, so we can avoid a C-section. But yes, there is a way to stop that process from gaining traction so that we can prevent you from having an early miscarriage between the first and second trimester. I have to leave at 6. Bye, Rachel.
Bye, Rachel. I think she left already. Thanks for coming.
Please let us know.
All right. Yeah. Bujang Ichi Tongue. We have some waves. We have some people who have joined in and discussing like that, holding the baby upness. Like that was I thought you had frozen. It was like, no, technical difficulties. That was one of the complications that I had with my own pregnancy. I had gotten in a car accident in my first trimester, and we did a really good job of holding him up and in place. So much so that at 41 weeks and change, I was still very pregnant, no cervical involvement, no effacement, no nothing. He wasn't dropping. He's just like, no, I live right here. Thanks. And I had 2 doulas, I had a midwife, I had acupuncturist, I had herbalist, I had people dosing me around the clock trying to get this little boy to move himself on down the road. And he was like, no.
Yeah. So it works. I'll just say that is an example of when things are working as we designed them to, but when it's time, it's like now your body has adjusted to a new norm, and that new norm is like keeping things so in place that the timing is now not comparable to what we actually want to happen at 42 weeks.
Yeah. All right, we got one more question. Are you open to discussing common patterns and approaches or your thoughts when helping menstruating folks transition from years of taking hormonal birth control? Good question. In terms of cycle regularity, and also when folks want to conceive, is there a recommendation of waiting a number of cycles before trying to conceive? So your thoughts on hormonal birth control. And let me tell you, I'm full of thoughts on that too.
Yes. Okay. Well, again, I'm saying this is what I'm going to be saying with my acupuncture and licensed acupuncturist hat on and with my herbalist hat on. Birth control, like I mentioned before, is marketed to be this remedy for everything. Just get on birth control. That'll help your period cramps. Just get on birth control. That'll help your heavy bleeding. Just get on birth control. That'll help your hormonal regulation. That is not true. Again, we have natural hormones that our body creates flowing through our body. The moment you add birth control, you're adding a hormone disruptor. So it's just not only disrupting the hormones that are naturally coursing through your body, however, they're also not recognizable as natural. So they're coming with a whole bunch of other side effects that you don't want. So for every year of birth control, you're going to need about 6 to 8 months to get that cleared out of your body. So let's just say you were on birth control for 10 years. I'm not going to say you're going to need 5 years to clear it out of your body. That's not true. But you're going to need to be consistent in your efforts to intentional about making sure you're clearing those toxins out of your body. Because even once you get the hormone, it takes about 3 months to get to therapeutic levels anyway, where that first 3 months you're having to use a backup. That same thing happens on the other end. But once you've built up birth control in your body, that takes now is taking the place of what's going on naturally, your natural bodily hormones. The message is, I'm the captain now. I'm the one who's running this show, meaning the synthetic hormones. And your natural hormones are kind of just back there singing in the background, not really doing anything in terms of own hormonal management. So in order to get that message out so that your body can start saying, recognizing what is physiologically normal for you, you're going to have to be intentional about clearing that. And that clearing process is a detox. Now, the detox should not happen when you're trying to get pregnant. That is not the time to detox. The detox needs to happen intentionally before you even think about getting pregnant, because some of the things that you're putting in your body to detox and clear are going to be released in ways that you don't want to be affecting a fetus. Because now, as you're detoxing when you're pregnant or about to get pregnant, then it's like, okay, now you're sending this message and your baby's receiving all that. That's not what you want. So my advice is when you're coming off of birth control, it needs to be a designed, concerted process. Not like, oh, I'm just going to go on this commercial detox that I saw on the TV or that. No, because again,
I hate those things.
every
Thinking on
detox
my
is
nerves.
not designed for everybody. You don't necessarily you need to be focused on your liver. Obviously, you need to be focused on your kidneys, but there's a way to do that for each person because it depends on what you're trying to detox from, in addition to the birth control. Secondly, when you are getting ready to prepare for pregnancy, and this goes for even if you aren't trying to detox from birth control, there's like I call it preconception care before you get pregnant. What should you be preparing your body for? Is it dietary? Is it mental? Is it emotional? Is it stress? Is there a job that you're working at that's just like not even conducive to helping you get pregnant? All those things come into play. So preconception care, whether you have are trying to detox from birth control or not, there's that 3 months that I'd like to work with a patient to get them really strong and get them really, their uterus prepared for pregnancy. And then after that 3 cycles, after the detox, then I could say green light, go for it. Especially if you have, know when you're ovulating, go for it. And piggybacking on birth control, because I know the next question is, well, if I'm not taking birth control, then what do I do? I am about the natural fertility awareness method and teaching women how to do that. And it is work. It is labor intensive in terms of, examining your own cervical mucus and your basal body temperatures. However, all it involves is time and consistency. And there's no birth control necessary. And it allows you to enjoy the act of being intimate with your partner, which also helps the conception rates and the ease of conception. So
Oh man,
it's two
that's
birds with one
important.
stone. But go ahead. I'm going to defer to you, Dr. Dandridge.
Yeah, I tell, in addition to like, you got to give your body a chance to kind of re-regulate itself. It's like a muscle, like your hormone muscle hasn't had to work for however long, and it needs to tune itself back up. But especially when trying to conceive, it is super important not to try to conceive. Just lovingly chase each other around the house or the park or the car or whatever. Just don't go to jail.
I mean, yeah, and if that's part of it, I mean, that could be a turn on for somebody. So you just never know.
No judgment.
Do whatever works. Emily, I see you laughing. Emily.
Like, shh, don't tell everybody my secrets.
But I mean, again, when people are trying to conceive, it's we use that abbreviation TTC, trying to conceive for a year, 2 years, however. And just that basic, it means that's the intention. And people are so consumed with trying to get pregnant. My thing is that is kind of taking away from the actual act of intimacy. And that relaxed aspect of intimacy is when your whole body is relaxed and you're enjoying it and you're enjoying the process, not like, okay, I'm ovulating now. You need to come home. My basal body temperature. I mean, all these things. And we
that's
need to
introducing stress. And when you introduce stress, you've introduced the fight or fright system. And once you do that, all hormones and everything goes off because your body cannot make a baby and run from a grizzly bear at the same time. It's not how that works.
Not going to work.
Not going to work. All right. I think we have come across most of the questions. I'm sorry, Instagram, that you got to keep seeing my messy computer screen back here, but I'm attempting to check Facebook for questions. And I don't really know how to check Facebook for questions. And I don't think I see any more of them. So that seems to be the bulk of things. If anybody else wants to send me a text message or type in on Instagram or type in on Zoom, any other questions that you may have about women's health and women's fertility. We've covered a lot of things. We've covered fibroids, we've covered PCOS, we've covered menopause, we've covered fertility, we've covered so many things. And the thing that I really like to tell people is that this is a process, right? This is not a surgical procedure. You don't get one acupuncture treatment and then you're done. For some people, it's a year. For some people, it's 2 years. For some people, it is a one and done. Like, we've all seen those magicals, like, I don't know what happened and how you got pregnant. Or why you never needed to have your cycles treated again. Just know that that's not normal. This is kind of a lifestyle change. And so working with an acupuncturist and working with an herbalist should be a lifelong bond. You don't necessarily have to see them all the time, but that you're definitely going to do once a month or once every few months. You got to learn how to drive your Lamborghini is how I like to describe it. This is your personal Lamborghini. And if you don't know how to drive it, then it takes a little while to get smooth with it before you can go from 0 to 100 and not crash. Right. So be patient.
And just to piggyback off of that, though, and I think the one thing that, again, where acupuncture and herbal therapy differs is that my job is to get you to a point where you're at that optimal homeostasis range. And once I get there, that means your body can do what it does naturally on its own without my help. And it should never be the goal. Like if someone's like, oh, I've been seeing my acupuncturist for 7 years. Why? You should not be going to your acupuncturist, once you get to a certain point, or you've never even gotten there. Now, you're getting tune-ups every 3 months or something like that, seasonally, or, oh, I had to, stop in because, it's flu season. I want to get a little, tune-up. Yeah, but it's not necessary for you. That's like taking, that would be the same as like taking headache. I mean, pain medication
That's
for your
true.
headache until infinity, because that's not how this works. And if you're constantly always going just because you're like, oh, I'm good, but I can't hold my, I call it holding your treatments. If you're
Hmm.
not holding your treatments, that means there needs to be some other adjustments lifestyle wise, because you're just getting tuned up and just undoing that, so that all you're doing is kind of just going to acupuncture to undo the work that you've done all week. And so we're only facilitators. We
That's it.
facilitate a process that your body can do it on its own. However, you have to do the work. And whether that's fertility, whether that's pain, whether that's um, endometriosis, fibroids, your body can heal from this. We're helping your body remember how to do it. And you also have to plug in and to keep that messaging consistent, so that when you go home, your body's getting that same message that we're giving through needles and herbs.
Yeah, I definitely give homework. I tell people, if you're not doing the homework, if you're not doing the work, if you're not doing the things, and if I haven't taught you how to deal with this, the body, the Lamborghini that you're driving in, then I'm not doing my job. At some point in time, you do need to be able to drive off. I have plenty of clients who check in. It's like, is this the formula? Like, that's the formula. And that's it. I don't actually have to see you. And like, I felt really good when COVID came about, because I didn't see a lot of my clients for 2 to 3 months. It was just like, and most of them kind of held steady. And I have some extreme health condition clients. They held steady for 2 to 3 months, and then like things started to kind of fall apart and deteriorate. But this time is incredibly stressful for a lot of people. So it would be normal for people to fall apart under duress, right? And don't take that the wrong way. If you fall apart under duress, that's normal, right? If you hit a pothole, you're gonna mess up a jack or a tire or an axle. Like you're gonna hit a bump in the road. You see your acupuncturist, and then you keep it pushing again. But if your acupuncturist is never teaching you how to drive your Lamborghini, then that is a problem. So before we lose too many more people, I want to remind everybody that what we're doing right now is we are doing a fundraiser for Dr. Matula Shakur. Dr. Matula Shakur is a political prisoner, and he was the grandfather, or one of the grandfathers, of acupuncture here in the United States, and he is still being held. And we are raising money to be able to donate to his legal defense fund and the friends and family of Matula Shakur. So as you purchase tickets, if you want to purchase tickets, if you want to go directly to his website and donate, please give, so that we can get Father Matula Shakur home. Next week, y'all, oh my God. Next week, we have Dr. Tolbert Smalls. We have the Dr. Tolbert Smalls. You guys should go look him up and find out a little bit about him. He was one of the other grandfathers of acupuncture here in the United States. Instead of being on the East Coast, he was over on the West Coast, out here with me down in Oakland. And he was one of the very first MDs to ever use acupuncture here in the United States. And so we have these two beautiful powerhouse African-American men who helped to bring this medicine to this country for the betterment of Black and Brown people in particular. So please don't miss out on that next week. Some of his slides are going to be going into like archives, because they're that old and that never been seen before. So don't miss out. You can totally reach out to Dr. Lorena White. Can you please give us your contact information, Dr. White, so that folks can continue to find you and research you and learn more about you?
As you were talking, I was putting it in because I was like, I think people are going away. So I
Yep,
put
they're going away.
our center's IG, I put Facebook, and I put the centers how to contact me via email.
All right.
And
So
I think that's
on
all the
Facebook, it is I can't say it. Help me. It's
the Evdaimonia Center. The Evdaimonia means human flourishing. It's a Greek word. And I wanted, again, we see predominantly most of our patients are women, but the one thing that was important to me is that everybody, from the time they cross our threshold to the time they leave, they're changed. And those changes happen incrementally, but the ultimate goal is that everyone can be flourishing, not just in their reproductive lives, but in life in general. And that is my goal in terms of every interaction that we have with every patient that comes through our doors. So it's the Evdaimonia Center. It looks like EU, but that U is pronounced like a V. Ev, DAI, soft, like the TH, soft D, and Monia. And yeah, that's how you can get in touch with any of us. And again, we hope to see you in some capacity. We look forward to whatever interaction we can have with you.
All right. Thank you all for joining us. I'm going to start stopping the recording. Thank you, my guests. I'm going to ask you guys to go ahead and log off. Dr. White, if you can just hang on. Thank you again over here on Instagram. Hi, Instagram.
Hi, Amy. I love to see you.
You
Thanks,
guys
Emily.
have
I
a
love your.
marvelous day.
Take care, everyone.
All right. Oh my God, so many. Hold on. I'm like stopping all the things. There's so many things. Stop. Okay, stop here. Okay, yes, I want to stop cloud recording. I want to stop. Of course, I forgot to stop.